And in fertility management for Isthmocele, how do you manage it and treat it?
Okay, so generally, so if there is Isthmocele, usually we manage it in an IVF setting. So unless patients are doing ovulation induction or IUI, you cannot tell when this fluid is coming in and out inside the cavity. So, and also it's not generally recommended to do ovulation induction or IUI if there is Isthmocele, because chance of successful pregnancy is very low. Normally you do IVF. So in IVF, really it depends on, again, the same thing, whether the Isthmocele is communicating. Sometimes like fluid can get entrapped, it's not communicating, it doesn't cause any problem. So you don't need to worry about it. If it is communicating with the cervix and uterine cavity, then you may need to manage. So first, whether it is communicating with uterine cavity, which means whether fluid is coming and flushing back into the cavity. So first, and second, whether there is a fluid inside the uterine cavity when you want to do a transfer. So generally, if you detect Isthmocele when we are doing IVF, if there is a fluid in the cavity of the uterus, we cancel the transfer. You get the eggs, create the embryos, freeze the embryos, and cancel the transfer. So then Isthmocele may cause problem during fresh cycles more than frozen cycles. Why? Because in fresh cycles, when you stimulate your ovaries, you push a lot of blood flow to your ovaries and your uterus because your estrogen is so high. So that can increase production of Isthmocele fluid. So, and in natural cycle, you may have a lesser amount of fluid and you may not have a fluid inside the uterine cavity. So one approach is if you see in fresh cycle, you freeze the embryos, and next time you can do natural frozen transfer cycle where you have physiological amount of estrogen and hopefully you do not have a fluid inside the uterine cavity, and then you can transfer. If you again see fluid in the uterine cavity, then you need to either deal with the Isthmocele surgically, or you can try HRT frozen cycle. In HRT frozen cycle, which is the artificial frozen cycle, you have a lowest amount of natural estrogen, then hopefully you do not have a fluid. If you keep having fluid inside the uterine cavity at the time of transfer, then you need to deal with Isthmocele surgically. Also, another option is if you see some fluid initially in the cycle, then if you really want to transfer, then you can do scan on the day of embryo transfer. If there's no fluid, then you can transfer. But still, you should expect your chance of implantation is a little bit reduced because there was a fluid in that cycle, in that endometrium. So ideally, you should cancel and then treat the Isthmocele, then do the transfer.